歡迎大家出席今日嘅簡報會。台上面兩
Welcome to the press briefing. On stage, we have Dr. Chang Chuk-Kwan, Head of Communicable Disease Branch, Center for Health Protection, as well as Dr. Sarah Ho, Chief Manager from Hospital Authority. Dr. Chang will give us an update of the situation. Last night, we had 113 cases by PCR, 22 from HA, and 23 from the Public Health Laboratory of DH, and 68 from private laboratory. 164 cases tested positive through RAT. So in total, we have 259 positive cases. We have a total of 1.19 million 575 cases, 747,701 by PCR, 448,104 by RAT. Our public health laboratory did genome analysis on 77 cases, 75 negative to L452R, and for 2, the viral load was too low for an analysis. Among the cases we have today, 33 were imported, including 26 tested positive by PCR, 7 by RAT. 17 cases were identified at the airport. 13 cases arrived on the 14th and 3 on the 13th. For the 13 who arrived on the 14th of March, they came on various flights. 5J 2722 cases, SQ8821, SQ8943, and Q3441, and also PK011 1 cases. The 4 cases who arrived on the 13th of May, they were on 2 flights separately. KL8193 cases and CX7041 case. 13 cases were identified at quarantine hotels, or from samples taken on day 3 to day 5. There was a case of a sample after 7 days. The case was still in a quarantine hotel because the case's family members were tested positive on the 4th and the 5th day, and so the case was still in a quarantine hotel, and the sample was taken on day 13. The case was never out in the community. And there was a case who arrived from the UK on the 2nd of May, tested positive on the 10th of April in UK. The sample taken on the 12th of May was positive with high CT value, and then on the 13th of May it was negative, so a repositive case. Another case arrived from Singapore on the 2nd of May, who was tested positive on the 15th of April in Singapore with a high CT value, so it's likely to be a repositive case. We do not have new case from care homes or schools on holiday today, so no cases. 1 additional death case from HA. We have had 9,070 cases, 9,148 cases in the 5th wave. 3,755 female and 5,772 male. For the clusters, Sunwon Club cluster, 1 additional case. So a total of 11 cases, 11 visitors of the club, and 2 staff members of the club. And for Sky Cuisine, 4 more staff members and 7 patrons. So 46 customers and 6 staff members are affected in total, involving over 20 families and over 20 tables. We have to look into the detailed distribution later. Apart from these 2 clusters, we have checked Liform Safe app's record. on a Shengyip Industrial Building, first floor, flat 12 on the 19th of Shengyip Street, Kwun Tong. There is a private kitchen, Yuxin, with 19 cases. On the 9th of May in the evening, they were at this place after 5 p.m. We're still studying the details, and we are investigating. Individual cases told us that they were there for a very short time. They were there to buy almond cookies or some other stuff. But then there are quite a lot of cases of people at this place. We will issue a compulsory testing notice for those who were there from 5 p.m. to midnight. They have to be subject to compulsory testing. Dr. Ho, the situation of HA, please. Good afternoon. We have 722 patients receiving treatment at public hospitals, North Nantou ICC, HA, IDC. Yesterday, there was no new critical or serious patients reported. One critical patient is still being treated at ICU. We reported one case of death, an 82-year-old female who passed away yesterday. She was not from a care home. She had 2 jabs of vaccine. 79 patients have recovered, of which 55 have been discharged. So far, 49,343 patients have recovered, 48,858 have been discharged. So far, 61,723 have recovered and 61,238 have been discharged. One patient, upon admission screening or in a hospital, tested positive. 7 patients in the same ward are now close contacts. 22,858 staff members tested positive. In total, 22,704 staff members have returned to work. And as for adjustment of our hotline service, HA has monitored very closely the change in the epidemic situation and adjusted our services accordingly. Because the epidemic has eased and considering the need for online service, starting from tomorrow, i.e. the 16th of March, HA will adjust the services for 18365511 and also Chinese medicine consultation line 1834511. For the former, 18365115 will see a service hours adjusted from 9 a.m. to 5 p.m. from Monday to Friday to answer queries and also provide advice on infection control. And as for Chinese medicine consultation online service, 18345511, starting from tomorrow, the service hours will also be adjusted from 9 a.m. to 5 p.m. per day, Monday to Friday. We're grateful to all the doctors and Chinese medical practitioners and nurses and nursing students for joining the hotline teams to do their part in fighting the pandemic. The HA will continue to monitor the development of the epidemic and the demand for services, and will adjust the services accordingly. Thank you.
你代表嘅機構。前邊中間白色衫嗰位。
Now
TV. The address of Yuxin's private dining, it's Gengyip building. So I'd like to ask, is that address correct? And additionally, I'd also want to know the patrons, they stayed at the premises from what time to what time? How many tables were there? How many patrons were present? How many staff got infected? Second, yesterday you mentioned that Sky Cuisine infected person lives in West Terrace. And the Thai import case, do we have the DNA results? Can we confirm that it's a community case? And I want to ask that the expert Leung Shok Wai forecast that there would be a sixth wave in 2 weeks. So if you look at the daily infected numbers and a cluster outbreak, is the risk high? And what plans do you have? And does the HA have enough beds to cope? And in the fifth wave, we saw a lot of people infected. So if the sixth wave occurs, will the scale be limited? And lastly, the experts suggest that we need to trace 7 days of leave home safe records. And previously, you would only trace 2 days. So will you consider tracing for a longer period? And the tracing office, are they capable of tracing 7 days? Well, just now we talked about you see in private dining. It has the Chinese character of moon. It's on Sengyip Gong Industrial Building on Sengyip Street. It is not the address you mentioned. It's a separate establishment. So are they patrons of the restaurant, or were they just purchasing takeout orders? We're still investigating because there were infected people and they said they didn't stay long at the premises. So we're still investigating. But at the same time, people who had visited the premises, they need mandatory testing. The majority of them patronized the premises between 5 p.m. to 7 p.m. So they don't have exact departure time. They did not swipe the Leave Home Safe app. They just said that they stayed a very short time. So we'll have to investigate further before coming to conclusions. We don't have the full DNA analysis, whether it is for Sky Cuisine or the Thai case. We still need more time. I'm aware that Dr. Leung made some forecasts based on mathematical modeling. So the forecast is based on data input and based on travel figures. We're seeing that social distancing is being relaxed and traffic flow might increase, and we also have to consider immunity and so on. Of course, we don't want to see another large outbreak, but during this time when there is no outbreak, we hope the public can use this time to vaccinate. Ideally, they should get all 3 vaccinations. So we trace more than 2 days. We trace the close contacts and Leave Home Safe. Usually, we trace 7 days, and we also look at premises or venues with high foot traffic, such as restaurants, catering establishments. The 2-day window is we focus on close contacts. In some cases, if the infected person and the close contacts, if they don't have symptoms 2 days prior to positive test result, during that window, we try to trace as many close contacts as possible. Right now we have 700 plus COVID patients in our government hospitals, so the demand for hospital beds has come down a bit, but you know that half of our accident and emergency beds are set aside to take COVID patients. So we have a total of some 10,000 plus beds, so we're able to serve COVID patients, and we also have designated COVID hospitals, so we will keep a close eye on the development. So whether it is A&E or hospital beds, we will maintain flexibility, and if necessary, we can make further adjustments and deployment. I want to ask that there was a question regarding Professor Leung saying there might be a 6th outbreak. So given the current conditions, what is the probability of a 6th wave? Now, we have so many infected groups. Will you consider tightening social distancing? And in the Sunmong Club, do we have the DNA analysis? What is the source? And lastly, the Golden Peony restaurant, do we have the patients recovered? The Yunlong Golden Peony, that we've already traced all the patients. 3 of them are not in Hong Kong. 3 are in Shenzhen, 3 are in Malaysia. I think the forecast is a mathematical model. We hope it doesn't occur, but when we have more traffic, more human interaction, people don't wear masks and they are not vaccinated. For example, previously we might have 5 million, 6 million who have been infected. There might still be some 2-3 million people who have not been infected. So they have been vaccinated. It might prevent infection, but we know that they can still be infected. So in an injection or vaccination, it just reduces the death rate or serious symptoms. So if 2-3 million people still don't have immunity, and when social distancing is relaxed, people have more interactions, there might be a rebound in cases. So the clusters, every day we have some 200-300 cases. So even if we do discover a cluster, it might be a cumulative record of 10 or 20 cases. So this, it would just be a subset of the 200-300 daily cases. So there might be hundreds of invisible transmission vectors in the community that we cannot discover. A lot of people might not have symptoms, or they were infected and they don't have visible symptoms. They might have been infected in restaurants. So we have to rely on vigilance, vaccination, and maintain social distancing. We need to have good health hygiene habits, and we hope that even if infected, it doesn't turn into a serious case. Social distancing, we have to keep an eye on the outbreak rather than number of cases. We have to look at sewage testing, environmental testing to see if there's a rebound. Next question. Commercial radio. Just now you mentioned the Seng Yip industrial building. So aside from first floor, what unit are they? I've found on the internet that there is a private kitchen, Jigei, private dining. Is that the establishment? Second, you mentioned the Sky Cuisine and the billiards club. Have you traced all the infected cases? How many more days do we have to? Do we need to find all the cases, and might that lead to further community outbreak? And third, the mathematical model you mentioned just now says there might be a 6th wave. So does CHP have any assessment of the situation? When will the government stop relaxing social distancing? The address is Seng Yip Street, 19 Seng Yip Street, first floor, unit 12. You've seen private dining. That's what the label. The Sky Cuisine and Billiards Club, their results are not in yet. Some individuals have not been tested, so we have to follow up. But the majority, we've seen most of the results turned in. The community has a lot of transmission links. That's why we have 200-300 cases per day. So when we uncover cases, we try our utmost to get them tested and quarantined. to prevent further transmission. But in all the cases, there is a quarantine order. If they are a confirmed case, we would want them to stay at home. Now, when do they discover they are a positive case? If they know they've been to high-risk areas, they need to be tested as soon as possible. If they are unwell, typically they will do RAT. The cases we found recently, you've seen private dining, I mentioned just now, a lot of the patients between the 11th and 13th, they felt unwell and they did RAT, rapid antigen tests, and some even did PCR tests, and they felt unwell and did a test. That is encouraging. Some people don't have symptoms. They might have to go to school, and they could do testing at the community centers. And most importantly, the earlier they find out they're positive, they can stay at home. That will help the community spread.
As regards social distancing measures, the government is closely monitoring it. It's not just for the CHB to consider. The whole government will keep a close eye on the development of the epidemic and decide on fine adjustment, etc. This gentleman over here. Good afternoon. I'm from Mingpao. I'd like to ask about the Kwun Tong case. Inside the private kitchen, Dr. Cheung said that patrons did not stay long. Can you tell us on average how long did patrons stay inside? Is it just a few minutes or a few dozens of minutes? And you told us they went in to buy almond or frozen meat. So I'd like to know whether the place sells groceries. Why were the patrons there? If they were there to buy stuff, did many of them remove their mask? What is your assessment of the risk involved? And as for Sky Cuisine, yesterday it was announced that 2 waiters were involved. One had onset on the 11th of May, and for the second waiter, were there symptoms, and what was the date of onset? A few staff members were involved. I have staff of Sky Cuisine eating together. Had there any mask or activities? What was the case of cross-infection among the staff? And we're told that a waiter lived in Saiwan Estate. Do you think there is any relationship between the Saiwan Estate cluster and the Sky Cuisine cluster? And is there any new development for the Saiwan Estate cluster? Now, for Sky Cuisine, the onset was the 7th of May, but there were still positive samples found on the 13th of May. And as for Sun Mong Club, the CHP said that 3 members were there to play darts, and for the remaining 4 customers, what did they do there? And what were the locations relative to the first 3 cases? We're told that some frequented the place even before the 9th. Is it true that some of the customers were there before the outbreak? And what is the situation of infection within the club? Now, for the private kitchen at Sheng Yip Street, we are still investigating the activities of the cases. Some told us that they were only there for 10 minutes or so. They left after taking their orders, and we have to investigate further to confirm and whether there was any mask-off activities. Now, Omicron is a highly transmissible variant. Now, if we have highly infectious cases there, even with a mask on, people can still be infected, and some might have been to the toilet. So we have to check the environment, take environmental samples, and confirm the activities there. Still, we want those who were there from 5 p.m. in between 5 p.m. and midnight on the 9th of May, they could be subject to compulsory testing. So for those who have been there after 5 p.m. on the 9th, they should be subject to compulsory testing. And for the staff of Sky Cuisine, they did eat together, so there could be cross-infection within the restaurant. Even though there are environmental samples, there might be cases who were confirmed and been there before the 9th of May. Now we have cases in the community. If there is already some infection, then we cannot pin down on a particular restaurant. But the situation at Sky Cuisine on the 7th of May was indeed an outbreak. The relationship between Saiwan Estate and also Sky Cuisine, we have to wait for results of genome sequencing. One staff member lives in Saiwan Estate and works in Sky Cuisine, but are the two clusters related? We have to consider the full genome sequencing analysis first. I think there are a couple of cases more from Saiwan Estate. One living in another unit of Saiwan Estate, and other. One more case from West Terrace involving one unit, and then from North Terrace, there's also one case. Sun Mon Club, some played darts there, and some played billiard. Some of them told us that they were at the club a few days before, but we noticed that more were there on the 9th of May. A few individuals might be there before the 9th of May, but we haven't seen an outbreak before that date yet. I'm from TVB. I've got a few questions. First, about the private kitchen. You told us that it was on the first floor, but we found information that is on the 12th floor. Can you tell us the exact address? And you said that the customers were there for a very short time to get stuff or to buy almond cookies. Can you tell us whether it's a restaurant or is there an outlet for buying gifts or what? You told us that there were many silent trains in the community. Would we have to widen the scope of compulsory testing? 19 Shengyip Street, Shengyip Industrial Building, first floor, room 12. That's the address of the private kitchen. If you have taken notice, we have more than 40 places under our compulsory testing notices, mainly premises and also places where there are known outbreak. Next, and the last question. Good afternoon, I'm from Cable. I'd like to ask about the real-time reproduction rate by Hong Kong U. Now, the data today has risen to the level for early March, which was the peak of this wave. Now we have returned to that level. Does that mean that another outbreak is brewing? I have to check whether the level is indeed back to the early March level. But it appears that my view is the real-time effective reproduction rate is 0.8965. The figure for early March was 3.4. So we're not back to that level. If the R is less than 1, well, if R is over 1, that's cause for worry. That means 1 has passed to more than 1 patient, and so it's a rising trend, and outbreak is brewing. But if the figure is below 1, that means the situation is still stable. But of course, I have observed a rising trend as well. The press briefing ends here. Thank you very much.